Welcome to Health Bulletin. Today, we're discussing a growing health concern in the United States, a respiratory virus that could be paralyzing children. Enterovirus D68 is making headlines as cases are being reported across the country, sparking fears of another rise in polio-like illnesses. But what is this virus? How serious is it? And what does it mean for public health? Let's break it down. Enterovirus D68, commonly known as a cause of mild respiratory symptoms like a runny nose or cough, is now back in the spotlight. Wastewater samples across the US have detected a sharp rise in this virus, and while it usually causes little more than a cold, in rare cases, it can lead to something far more dangerous: acute flaccid myelitis, or AFM. This rare but serious condition attacks the nervous system, leaving young children paralyzed in their arms and legs. AFM first came to public attention in 2014, when the US recorded a spike in cases. 120 children diagnosed with this debilitating condition. Since then, the country has experienced waves of AFM every other year. 153 cases in 2016, 238 cases in 2018. But in 2020, when the pandemic lockdowns brought life to a halt, AFM cases dropped to just 32. So, what's happening now? The rise in D68 infections is concerning, but the full picture remains unclear. Some experts suggest the virus itself may have changed, becoming more virulent, while others believe increased immunity in the population may be playing a role. What we do know is that predicting how this virus will behave is proving to be as difficult as ever. Even the best virologists are constantly trying to stay ahead of these ever-evolving pathogens. Researchers are exploring possible treatments, but there's no cure for the paralysis caused by AFM. Even intensive physical therapy has limited success, leaving many children with life-altering disabilities. The medical community is working on experimental treatments, including a promising monoclonal antibody that in mouse studies has shown the ability to block infection leading to AFM. However, human trials are still in the early stages and could take years before they yield a safe, effective treatment. The big question now: we've seen the virus peak every other year, but with the pattern interrupted by the COVID-19 pandemic, we are in uncharted territory. It's difficult to predict how far D68 infections might spread. What's clear is that healthcare facilities, already stretched thin by the ongoing pandemic recovery, may soon have to grapple with a new challenge. Parents across the country are understandably worried. This virus targets young children, those most vulnerable to severe outcomes like paralysis. While health authorities are monitoring the situation, it's crucial to recognize the need for vigilance in hospitals and communities alike. Enterovirus D68 is yet another reminder of how unpredictable viruses can be. Whether it's a new strain or simply a surge in cases after years of lockdowns, the stakes are high. The medical world is racing to find solutions. But for now, the best defense is prevention and monitoring. The real question is, are we ready to handle this evolving situation with AFM cases? Or will we once again find ourselves scrambling to protect our children? Stay tuned to Health Bulletin for more updates on global health concerns, and don't forget to subscribe. Stay informed, stay safe.